Dr. Lilino.
Mr. Deputy Speaker, sir, I stand in support of the Vulnerable Adult Bill. I've always been concerned about the vulnerable adults and have since 1999 raised the issue on better protection of our vulnerable adults and especially the abused seniors. I've spoken about the predicament of vulnerable adults being abused and have beseeched our government to better assist them at least 9 times in this House. I'm glad indeed that MSF will soon put into law to better safeguard the vulnerable adults. Over the years, during my speeches on this topic, I raised the issue of neglect of the vulnerable, physical abuse resulting in injuries, emotional trauma, psychological anguish, deceit of fund, and financial abuse. I'm glad most of these are now covered in this bill. However, this bill does not cover the financial abuse as mentioned by other parliamentarians earlier. We need to address financial abuse in these vulnerable adults. Let me elaborate. As mentioned by parliamentary colleague Mrs. Sia Kian Peng earlier, a 2014 study by TransSafe Center, a charity that specializes in tackling elder abuse, showed that about 1 in 3 involved a senior who had been financially abused. With each passing year, the growing numbers of seniors will reach 900,000 by 2030. Many of them would have some savings from their long working years, and they may be subjected to financial abuse. This will be an increasing problem with time. I've heard residents and patients relating to me that they had to give in reluctantly to their difficult children who might be drug abusers, ex-convicts, or gamblers when they demanded money from them. The seniors said they were afraid of their children, scared of their tantrums and tempers and abusive words if they didn't give in. There were also stories of unpaid borrowings by children, deceit in transferring of HDB ownership, and so on. Thus, this bill is not complete with omission of the financial abuse issue. During one of my house visits, I saw one debilitated senior on her bed through her house gate. She was too weak to even sit up or talk to us. The home was in an unhygienic state. Her gate was locked by her only son when he left to work early in the morning and would only come back late at night. I considered it as a case of neglect, either due to circumstances or willfully. But the senior would not complain, as she was too afraid to lose whatever she had left and had resigned to her fate. Thankfully, we managed to find her son and persuaded him to allow us to assist with his mother's daily needs and medical needs henceforth. I hope this bill will enable individuals like this to be identified early and help rendered before it is too late. The role of the community is important to better protect the vulnerable adults. Extended families and neighbors are usually the first to know of the vulnerable adults at risk. Publicity and raising awareness on this topic and information on the kind of assistance available are thus very important. I welcome Part 4 of Clause 23, which provides protection to whistleblowers for providing the information on abuse or neglected cases. This clause protects whistleblowers from liabilities. This fact must be well publicized to encourage more people in the community to report. In publicity material, tips on what to look out for will be useful to further raise the awareness. Such relevant information includes poor hygiene, malnutrition, dehydration, physical injuries like bruises and fractures, unexpected injuries, mental trauma, depression, as well as social isolation. The people in the community, the family and friends, as well as the neighbors, and the frontline personnel such as medical doctors, nurses, and social workers play an important role to ensure the success of this act when it is enacted. In our society, there is a strong disapproval of abuses, especially so on those vulnerable. I hope MSL will spare no effort in facilitating the community to play their part in our responsible and caring society. There is a need for easy, one-stop reporting and good follow-up provided by MSF. The convenience of designated 24-hour hotline to call for reporting on information will be useful. I hope that with this act and the good execution efforts by MSF, we can prevent another case of Miss Annie E., who died from the injury of frequent abuses over a long period. May I ask the Minister whether this bill goes far enough in creating a criminal offense for the abuse or neglect of a vulnerable adult? Does this bill send a strong signal to the perpetrators on their wrongdoings? Now that there is this act, we need to have a deterrence to ensure that family members do not push their dependents away to MSF by causing neglect. Otherwise, perpetrators may walk away from their responsibilities if they know that they can get away easily. Under Part 3, Clause 19, 1 and 2 of this bill, the Minister is empowered by notification in the Gazette to designate any premises in Singapore as a place of temporary care and protection for the care of vulnerable adults from abuse, neglect, or self-neglect. I welcome this. In many cases of abuse, the best way to end their plight is to remove the vulnerable from their homes and place them at designated facilities that can provide better support and care. May I ask MSF, what are these places and whether we have such avenues and such facilities available before enacting this bill? We have to make sure that the vulnerables are not worse off with our intervention. I also hope that MSF will ensure that the vulnerable adults at risk receive as much information on their alternate care and assistance available to them. The fear of the unknown, away from their familiar environment, and the fear of losing whatever little care and support they are getting may prevent the vulnerable adults at risk from giving their consents for interventions involving removal and out-of-home placements. This is especially so for the seniors at risk. Under Part 2, Clause 5 and 6, this bill empowers the director or a protector to assess an individual or a vulnerable adult to be assessed by a qualified assessor. May I ask, Minister, if the assessors can do both a physical health assessment, such as detecting malnutrition and body injuries, as well as mental assessments to detect mental anguish, trauma, and depression? Every assessment can only be complete with both physical and mental well-being taken together. Will these assessors be at hand on the enactment of this Act? I hope that MSF will implement this Act thoroughly to ensure its success. Areas of priority are good publicity, getting the buy-in from the community, and enough personnel that will carry out their duties diligently. The success of all these will save our vulnerable adults from unnecessary pain and suffering, and this is only rightly so in our inclusive, caring society.